Hi friends, welcome to my channel Sharing Simple Knowledge. Today we are going to discuss a case note for a hematologist. So let's see how we can write it. So first of all, the patient name is given Mr. James Brown, 72-year-old patient is in the medical ward of which you are the head nurse. So the patient information is given and our position is given. We are a head nurse in the medical ward. Then the hospital name is Gosford Private Hospital, 21 Main Street, Gosford. Then the patient detail, name, already we know from the beginning. Then marital status, married but no children. Residence, Gosford Old Age Home, Gosford. The admission date is 7 March 2013. Then diagnosis is nephrotic syndrome 20 amyloidosis. That is a condition which is rare condition. That one it is caused by abnormal protein and from the plasma cell dyscrasia. Then what are the present complaints? Admitted with a generalized edema. Then painless swelling of both legs. Initially, this was happened initially. Then face puffiness in the mornings. Weight gain of 10 kg in 3 months. Frothy urine, SOB but denies chest pain. Then spontaneous bruising 6 months. Then past medical history is hypertension 13 years ago. On tab atenolol 50 mg OD. Myocardial infarction 4 years ago. Then social background, retired heavy vehicle driver, lives with wife, smokes 30 cigarettes a day, 30 units alcohol a week. Then the lab values are given here. Hemoglobin is 10.7 gram per deciliter, sodium 138 millimole per liter, potassium 4.9 millimole per liter, and urea, creatinine, albumin is low, it's showing it's decreased, and the urea is elevated. Then urine, there was this plus the severity, how much protein was present. So there was 3 plus protein, that means high amount, but no blood. Then what are the management done? Renal biopsy done, bone marrow aspiration done, and from that one it has revealed excessive plasma cell dyscrasia. That is the diagnosis for the amyloidosis. Then the echocardiogram was done, prominent V wave and pansystolic murmur plus cardiomegaly. Then what are the nursing management done? Fluid and salt restriction and diuretics to reduce the edema and anticoagulants. Then definitive treatment is the chemotherapy to suppress amyloidogenic plasma cell clone. So that is the treatment they are suggesting here. Then what is the writing task? Using the information given in the case notes, write a letter to the hematologist of Royal Field, Prince Adelaide, requesting him to consult the patient and advise chemotherapy regime and further management of the disease condition to the patient and relatives. So we know our reader is hematologist, and what all information a hematologist should know only we should include in this letter. And what is the purpose of writing letter? Asking him to advise regarding chemotherapy regime and further management. That is the request from our side. Okay, so what all information we have to include in this letter? Of course, the name and the date, age, then the present diagnosis, presenting complaints, then past medical history. Anyhow, myocardial infarction is already finished, so no need, even though it's not mentioned, it's okay. Then hypertension we can still, because it's still ongoing. Then this information, social background, no need to include, because even the hematologist doesn't want to know all this information to manage the patient. Then here the lab parameters, the elevated ones, the normal one no need to include. And if there is any deranged one, like albumin is low and urea is high, we should include. Then the protein was present. Then what are the management has done? Renal biopsy, bone marrow, aspiration, then what is the finding, like that we can write. Then the nursing management, what we have done. So this is the way how to write. Then the request the chemotherapy. So let's see one example for this letter. So as the name is not given, we can write the hematologist. Then Royal Field, Prince Hospital, Adelaide. Then the date, as there is no discharge date given, the exam date will be the date they are asking, so we can just write one date here. Okay, then or even the same admission date we can write, because no discharge date is given. So then the salutation is dear doctor. Then reference, who is the patient? Mr. James Brown, age 72. Then how we can write the introduction? This is a referral letter for a hematologist, no? So we can write, I am writing to refer, or other way we can write, I am writing to introduce, or the purpose of this letter to request, like the refer Mr. James Brown. There are different ways. Just practice your own way and write it. Okay, no need to follow the same example like that. You can write in your own way. So I'm writing to refer Mr. James Brown, who has been diagnosed with 20 amyloidosis and nephrotic syndrome. That is the diagnosis. Then what is the purpose? He requires your expert evaluation and advice regarding chemotherapy. So always make sure what the spelling of the advice. If it is noun, it should be C here, and if it's a verb, the procedure that is it should be S. So don't make mistake there, because it can cause to lose your mark. Then next, what we have to inform, the present complaints. So Mr. Brown was admitted to hospital on 7th March 2013 due to generalized edema. Then initially he had painless swelling of both legs, facial puffiness, frothy urine, and shortness of breath. Therefore, a series of investigations were performed. We don't want to mention one by one, we can write it together like that. A series of investigations were performed, which revealed low albumin in the blood and high protein in the urine. So only I included the abnormal findings. Then next, what are the procedures they have done? In addition, he underwent renal biopsy and bone marrow aspiration, in which plasma cell dyscrasia was shown. He was managed with diuretics and anticoagulants. He was advised to restrict fluid and salt intake. Then we are going to the recommendation, and only for this one medical history, no need to write one line, so we can write together with the recommendation. Okay, considering the above information, or in view of the above, it would be appreciated if you could explain chemotherapy regime and further management of the disease condition to Mr. Brown and his family. Then please note, he has been hypertensive for 13 years and is on atenolol 50 milligram once daily. If you are writing, Mr. Brown has been hypertensive, that is the adjective we are using. Otherwise we can write Mr. Brown has had hypertension since, like that. Okay, so if you are using has been, then you should use adjective. For another example, Mr. Brown has had diabetes mellitus since 2000. Or if you are writing Mr. Brown has been diabetic for 11 years, like that. I think it's clear for you. Then the closing sentence we reach, please do not hesitate to contact me if you have any queries. If you are writing to a doctor, you can write like that also. Please do contact me if you have any queries. We don't want to ask the doctor, do not hesitate, like just write, please do contact me if you have any queries. Then as the name of the reader is not mentioned here, you can write it, yours faithfully. Our position was head nurse, so head nurse. Then the hospital name we can write, even though it has not written, they will not penalize you, so goes for private hospital. I think it's clear for you, and if you have more doubts, you can just comment below the comment box. Thank you.